Welcome, everyone. My name is Natalya Mytareva, and I am the Executive Director of the Certification Commission for Healthcare Interpreters. And I am extremely honored today to have my colleagues talk about a very interesting new concept about defining grades of interpreting and how they relate to the demand, supply, and other aspects of our field. Um, Before we start and dive in, I want to uh, go over some household things. First, you are participating in a Zoom webinar format, not Zoom meeting. Be aware of that. So you're all on mute and your webcams are off, except for us, the panelists and our wonderful sign language interpreters. Also, you do have the opportunity to interact with the panelists. After the webinar and during the webinar, feel free to put questions into your Q&A app in the portion on the Zoom where you have the Q&A icon, and we will address those questions at the end of the presentation. As far as the continuing education part, because it's a topic that does enrich your understanding of the field in general, you will get 1.5 continuing education hours. The certificates will be emailed to you by December 1st. They will be emailed as a body of the message. They will not be an attachment. This webinar is recorded. However, the recording will not be sent to live attendees. It will be available on CCHI's website, and you could definitely, refresh your memory and share it with your colleagues afterwards. And it also will be somewhere within the next couple of weeks. And now, without further ado, I would like to introduce my colleagues and panelists for today's webinar. And I will start with Mila Golovine because we will let Alan and Arle introduce themselves later. And Mila is the founder and president of MasterWord Services, a global language service company that is very well known in Texas and also across the interpreting world, because Mila is also known as presenter and trainer for interpreters. And if you haven't heard her presentations, especially about vicarious trauma or human trafficking, I strongly advise you to find the opportunity to attend them. Mila is also known in the business world and received several business awards as a woman entrepreneur, but also as a successful business person. And Mila and I do share also a background of speaking the same language. That's why I call her by her short name Mila rather than Ludmila. And this spring we worked on a topic that is a soon will be launched publicly, about standards for language proficiency for interpreters. And Mila said, hey, have you heard about this new initiative in the translation world called Translation Grades, how you estimate the level of translation. And I think that'll be something important for interpreters as well. Let's talk to Arle Lommel and Alan Melby, whom I've known previously, and see if that'll be helpful to us. And we got together, we talked, and we all decided, like, well, we definitely want to share this with the rest of the field. And that's how today's webinar got, into being. And Mila, tell us more about how did you stumble upon this concept? What brought you to talk to Alan and Arle? And so tell us.
Well, actually, I was dealing with the same question that many of us have been dealing with over the past quite a few years, and that is a continued decline in rates and a fall of rates in our industry for both professional translators and interpreters. We're all expected to can improve our professionalism, learn, get continued education, study, and then every time the rates continue to fall. And then at the same time, the challenge of dealing with that other 80% of large institutional clients who what is like Common Sense Advisory would define them a low maturity buyer, where they don't even know the difference between translation and interpreting, and far less can understand what is the difference between Google Translate and whatever little apps that are showing up with the interpreter and a trained interpreter. I'm sure many of us on this call have been involved in advocacy for our industry, especially advocating for the need for certified medical interpreters. We in Texas have failed once again to even start, to have the legislators hear us, that we want to have interpreter certification in place. And again, because people don't understand the concept. So dealing with that challenge, I was discussing with a group of professionals, what do we do about it? And I brought up that question to actually CSA, Common Sense Advisory, as a discussion point for one of the events that they were hosting. And Arle said, I may know somebody who has been not just talking about this problem, but who may have a solution for this problem. And there comes Alan Melby to save the day again. And regardless of the introduction that's made about Alan, I would like to say that I met Alan Melby in the early 90s at the conference called LISA, that was at that time dealing with machine translation and the concepts of standardization. That was back in the day when you had to have a separate computer to have Chinese and a separate computer to have English. And how do we standardize how do we standardize how do we standardize that without going into more technical discussion? And that became the foundation for what is now Gala, Localization World, TAOS, and many other groups and industry concepts that evolved by that. And so Alan is kind of viewed as the father of translation memory, machine translation, and all of the whole localization industry in a way. So I'm very excited and grateful to be actually working with Alan or engaged with Alan in this conversation. I think that the interpreting world will benefit tremendously from this discussion and this work. It will probably not be applied exactly the same way it's applied to the written word, because we're challenged with not just the technology that is coming into the world of interpreting, but also with the low instance languages and the challenges that are associated with low instance languages. So it's a more complex challenge, but I think together we can solve it. And so with that, I would like to pass the conversation to Alan and Arle. Go ahead, guys, take it away. Natalya, you muted.
And for the audience now, we're going to go off camera so that we can allow you to see this shared screen and our wonderful ASL interpreters to help the audience who is hard of hearing or deaf.
Thank you, Mila, and thank you, Natalya. We're grateful for the opportunity to address this audience today on the topic of grades for translating and interpreting. This will be a new topic for most of you, and we'll be presenting a lot of information to you. But first, let's give a little background about us as speakers. My name is Arle Lommel. I'm a senior analyst with the independent market research firm CSA Research. I formerly worked at the German Research Center for Artificial Intelligence, DFKI, in its Berlin-based language technology office, where I focused on issues related to translation quality and how to measure it and work with it in both machine and human contexts. Prior to that, I'd worked for the Localization Industry Standards Association, or LISA, for many years. And I was, in a former life, a student of Alan Melby, with whom I'm co-presenting today. Now, just as a quick note about CSA Research, we're an independent firm that focuses on what it takes for enterprises to go and stay global in all aspects of their business work. We focus on the constituencies shown here on screen: buyers, LSPs, technology vendors, freelancers, and global consumers, and cover all of these sectors in various ways. Think of us as like Forrester or Gartner for international business. And with that, Alan?
Thank you, Arle. I am president of a small nonprofit, very nonprofit, called LTAC Global, small organization with a prestigious, ambitious name. But we do provide services to various aspects of the language sector. We host, for example, Terminorgs, an organization for terminologists in large organizations. And we promote various standards and help develop them and develop tools for users. I'm also an emeritus professor of linguistics at Brigham Young University, where I continue to work with the Translation Research Group. And I'm the chair, newly elected chair, of the North American Regional Center of FIT, which is the International Federation of Translators. Thank you for Mila as well. I thank you for making this opportunity and allowing us to explore this new ground. We've really focused on grades for translation, and now this is our first attempt to see if it applies to interpreting. Let's see what happens, Arle.
Okay, thank you, Alan. Now, as an important note before we go on, this is an adaptation of a presentation we had originally crafted with translation in mind. But after talking with Natalya, she wanted us to present this for interpreters. So we have adapted it to some extent for interpreting so that we can use this to start a discussion about how grades may apply to the interpreting field. In terms of the agenda, we'll be speaking today on the following topics. First, we'll talk about why we cannot talk about quality levels and why that concept introduces problems into the discourse about quality. Second, we'll talk about the economic concept of information asymmetry and why it applies to our discussion. Third, we'll be talking about how we define translation quality. And with that as a background, we'll then really move into what we mean by grades for translation and interpreting. And then we'll talk about how we define those grades. At that point, we will turn to the benefits that we can achieve from grades and hopefully convince you that this is a worthwhile concept. And we'll close with a discussion about the current status of standardization for grades of translation and look at what may happen with interpreting in this area. At the end, of course, we'll have time for questions, so please submit your questions in the Q&A panel or in the chat window. So, first thing first, let's look at why we don't want to use the term of quality levels. Many of you will be familiar with the notion of quality levels. You've probably heard this, and this concept is widely used, but we contend that it introduces some problems. The notion of quality levels is the idea that you can sometimes accept something that is low quality or perhaps called good enough, but it isn't ideal. That you accept something that is poor. This enshrines the idea that quality is something that is dispensable. Grades, as we'll be discussing them today, aren't quality levels, but rather categories of translation defined by use cases and requirements. You can think of the term as grade categories, if that helps, and shorten to grades. But the idea is that it points to different kinds of translations. Now, to expand on this point, we want to draw your attention to really the fundamental principle of quality management, one that isn't always recognized in the translation and interpreting sector, which is that quality is really defined as meeting appropriate expectations. And I emphasize appropriate here. You can have inappropriate expectations or unrealistic expectations, so they have to be realistic and appropriate. If we talk about levels, however, we're assuming that low quality can be acceptable in some cases. However, again, from this quality management perspective, requests for low quality or expectations for poor quality are never acceptable, simply because you always want something that does what it needs to do and meets expectations. Now, in addition, quality levels assume that there is a single ideal for translation or interpreting that applies in all use cases, but that sometimes you can settle for less than that ideal. By contrast, quality management says nobody should ever settle for less than quality. But what that means depends on use cases and can vary, such that what is considered quality for one application may fail to meet expectations in another, and thus not be quality at all, and vice versa. And I'll explain kind of how this works in a moment, using an analogy from industrial settings. We accordingly need an alternative to the phrase quality levels, one that does not bring in misleading and harmful assumptions that can lead parties to accept poor quality or something that doesn't meet your requirements. Now, we propose to use the term grades, which we've already mentioned, and this is a term that's well established in quality management. So let's take a look at two examples here. The first one is grades for bolts. You see that on the screen. There are 3 SAE grades for bolts. These are defined in standards. And grades are categories of products defined by requirements for a product or service relative to use cases. Each of these grades of bolts serves a different use case. At the left-hand side, you have a grade of bolt that's going to be suitable for a lot of purposes where you don't have a lot of shear or stress on the bolt. It's going to be able to hold together things like maybe bolting together a garden box. But as you go to the right, the requirements become more and more stringent for strength and at various aspects. And so there's this continuum or this grouping of 3 grades of bolts that all serve different purposes. And notice earlier I said that what meets the requirements for one grade may not meet those for another. So for example, if you need the grade on the left, that class, you may not want the one on the right because it's going to be heavier. It's going to have some properties that may be undesirable for cases where you'd want the one on the left. Similarly, if you need the grade on the right, which has high strength requirements, if you use a grade that's not of that, doesn't have those same properties, you may be introducing danger and risk because the bolts could break or lead to failure. So products, when we look at them, either do or do not meet grade requirements. You find the features and you say this is grade A or grade B or whatever it may be. Similarly, if we look at eggs, which are shown at the bottom, we have various grades of eggs that serve different purposes. Now, grade B eggs aren't very aesthetically pleasing. They probably taste the same as a grade AA egg shown on the left, and we aren't talking about spoiled eggs or eggs that are otherwise unfit for human consumption. But grade B eggs are usually used in bulk food processing applications where people just don't care what it looks like because it's going to be mixed in. Now, if you're a home cook, you use grade A. It looks attractive. It tastes good. This is what most people want if they're going to fry an egg and have it look right. But if you work in a Michelin 3-star restaurant, you're probably going to use grade AA eggs because you have such a premium on how that egg looks. That looks like an egg should look. So here the criteria are based on appearance and the thickness of the yolk and the white and other things. And you could substitute a grade AA egg in for grade B, but it would be a waste of money. You couldn't use a grade B egg where grade AA is appropriate because it wouldn't look right. And so each of these grades has properties that makes it more or less suitable for a particular use case.
But just a minute, Al, you said it wouldn't look right. It's like there's only one right way for an egg to look. Before you said it's relative to use case.
Yeah. Okay, so yeah, if it looks right for what you expect an egg that you're going to serve your family as.
There we go.
But if you're making scrambled eggs to make pucks of egg for service in a fast food restaurant, you don't care about that at all. And it will still look right because everybody expects that yellow brick that kind of resembles egg that they put in a sandwich. So the grades help you identify what you need for a specific use case. And that's really the purpose of what we're talking about today, is how to build grades that will assist individuals, companies, and everyone involved in various aspects of the language industry to align their expectations. Now, why do we need this? Well, in an ideal world, we wouldn't need grades because everybody would understand their expectations and be able to convey their requirements. But we live in a world where not everybody knows the same thing. Different people have different levels of knowledge and different expectations. This is something known in economics as information asymmetry. Specifically, buyers of translation or interpreting are not generally able to evaluate quality of these services or of translated content directly, simply because they don't understand the target language and they don't understand what's being said. If I was asked to translate a book on Zen Buddhism and instead turned it into a book on motorcycle maintenance, well, that wouldn't be a quality translation, but the person buying it might not know that until they publish it and get a complaint. So really, this is a key area that the buyers don't know, can't tell what they're getting. Now, on the other hand, as a provider, if you provide translation or interpreting services, you have experience in meeting or exceeding client expectations regarding quality. But often, because you don't know exactly what they want, you may work extra hard and over-deliver to avoid complaints, even if that means providing more than your client needs in some cases. Now, buyers also face internal pressures regarding price and other business factors, such as time to market, that can lead to them trying to gain suboptimal solutions. They may want something that's too quick or too cheap, and they need to be able to understand what they're getting and how those factors affect what they're likely to achieve. Now, as providers, you also face strong competition based on that, that leads to pressure to meet often unrealistic customer expectations. And I'll just mention in passing here that CSA Research did a survey of interpreting and translation service providers and freelancers, and many of them report that they feel pressure to deliver things that don't meet quality expectations because of price or timing concerns. And so they need a way to be able to push back at this and convey to customers what they're likely to get. Another factor that affects buyers of services is often they may come in with a good idea of what they want, but then they have to filter that through a procurement department that doesn't care. A procurement department that's used to buying bolts and widgets and doesn't understand how to buy translation or interpreting.
At this point, I think we should be asking the audience to think about how procurement works in interpreting. We've talked about translation, different types of content, but there are certainly different circumstances, different use cases for interpreting. There's conference interpreting, simultaneous, consecutive. If you request simultaneous and you get consecutive, you're not going to be very happy because you didn't get what you requested. And so we could even talk about maybe different categories of interpreting at some point as we apply this concept.
Yeah. And this idea of different categories where things apply is one we'll be coming back to. Okay. Now, also note that as providers, you may find that you're frustrated by your inability to convey your value proposition. I don't know, well, in interpreting, surely we see cut rate providers who want to pay their interpreters, $2 an hour or something. And how do you distinguish what you do as skilled professionals from what they're doing that is unlikely to meet expectations? And here we believe grades may be able to help. Okay, with that, note also that MT hype, so this idea that machine translation is going to be has surpassed human capability, does better than human. This is something we've heard in media and certainly has been popularized in science fiction. And the fluency of neural machine translation have really inflated the perceived capability of unedited or raw machine translation. And this leads to confusion about the value of human translators and their role. And just in the past few days, we've heard about cases where major tech companies have thought they're going to roll out machine interpreting solutions for use in healthcare and other environments where it's completely inappropriate, and it will lead to potentially catastrophic effects. So we have to push back against unrealistic visions or views of what technology can achieve. Okay, with that, Alan, turn it over to you to talk a bit about what we mean by quality.
Thank you. Well, we've already said in general that quality is meeting appropriate expectations. But let's take that general or generic definition of quality, which is consistent with ISO 9000, which is essentially the embodiment of the ideas of a whole generation of quality managers. And let's make it specific to translation. Now, at some point, we'd want a definition of quality that applies to interpreting services. But here's a definition for translation. A quality translation demonstrates the degree of correspondence required between the source and target text. Well, obviously, interpreting, there should be some correspondence between what is said and what is interpreted in the target language, and level of target fluency. So, well, that actually could possibly apply to interpreting. Do you want the interpreter to sound as like a native speaker of the target language, or is that not really very important? Is it important for them to have a really smooth presentation, and you're willing to, for example, to pay extra for that? Or is it just in a private setting to get a message, an intended message, someone else can interpret approximately the same message that was intended, and if they stumble a bit, even have less than perfect grammar, it fulfills the use case. So that's the fluency there. I think that applies to interpreting. I've tried interpreting. I'm not an interpreter. I'm a certified translator. So I may be speaking nonsense here. It's up to you to tell us in the question and answer period. Now, so you have the correspondence between source and target, and the level of target fluency required for the audience and purpose. Well, that certainly applies to interpreting, and complies with all other specifications negotiated between the requester and provider, taking into account end user needs. So typically it's three different parties. The party requesting, who may be a procurement officer and doesn't really understand much about the situation, and then the provider, that's the interpreter, or the interpreting company, and then the end user, obviously, person listening to the interpreting. So I hope you can see that this translation-oriented definition of quality applies fairly well to interpreting. Let us know.
I'd like to add about this all other specifications that I think it's important to understand that this is deliberately a broad thing. So you might say the specifications are that the interpreter have a soundproof booth and very specific equipment, and that there be hearing protection and all the other things you need to function as a professional. And if you don't get those, you might walk away from the job, or you might say, well, I can interpret, but you're going to be losing some of what I would normally provide because you haven't met your requirements. So these specifications need to be defined in order to achieve quality.
Thank you. So, needs analysis. The first thing you do, before you even look at a possible grade of translation or interpreting, is to identify the use case. That really is the first step. Now, what is the use case? Well, what's the scenario? Is it court interpreting? Is it healthcare interpreting? Is it something in the government? And there are lots of different use cases in the government. What is the subject matter? Clearly important for translation and interpreting. You got to have somebody who knows the domain, is acquainted with the terminology. Then there's the audience. Who is the audience of this language service? What is the purpose? Why are we even doing this? In translation, why are we even translating? Well, pretty much you know that in interpreting. You know why you're interpreting. But sometimes you translate stuff and nobody looks at it. And then, of course, you've got to take into account, as soon as you've identified the use case, you've got to say, before I go into production, I must conduct a risk analysis. What is the risk of the specifications or the requirements I lay out, that's part of them being appropriate. Do they include or suggest undue risk? Now, finally, we get into grades of translation. So you have a use case in mind, and you say, okay, what are grades? Well, they are a shortcut for a bundle of use cases and a set of requirements. They are not, in translation, they are not the method of production. So to say, oh, this grade is machine translation grade. No, that doesn't work with quality management. Machine translation is the method of producing this grade, could be the method, or some other method could be employed. But the grade has to be defined in terms of use case and requirements. And in particular, we look at two features, two kinds of requirements: correspondence and fluency. Now, grades are a starting point. They are pre-production, and they are not a tool for evaluating the result. You can say, well, we requested this grade, we selected a method of production, we produced a result, and then say, did we, and here's the term, make grade? The grade is not the evaluation tool, it's the requirements against which you're evaluating. Now, what else do we do? Oh, there's a missing step. I almost forgot an important step. The step between use case and selecting a grade, conducting a risk analysis, and then making a full set of specifications. You should never go into production, and this is a kind of a separate discussion, but it's a very important one. Never go into production until you have a full set of specifications, because otherwise you're going to have different people in the chain, production chain, who will make up their own specifications, and they'll often not be the same. And you get something that says, well, that's what I thought you wanted, I assumed you wanted, but that should be clear in the specifications.
Okay.
Now, our translation or grades of translation, like other grades. Some of you are probably asking yourself, are these like school grades? Why did they use this word grade? When I think of grades, I usually think of what I received in school. Well, the answer is yes and no. It depends on what kind of grading system your instructor is using. If the instructor is grading on a curve, that's not what we're talking about. We're talking about what's called criterion referenced grading or testing, where you establish in advance the requirements for obtaining a particular grade. And then there's a really close connection between grades of translation and school grades. If you go into the first day of class and the first thing that happens is say, well, you know, guys, what do you want? What grade do you want? You want a B? Here's what you need to do to get it. You want a C? Fine. If you want an A, well, you're going to have to do this and this. Well, and you know in advance, because it's criterion referenced, you're not competing with the other students, because there's not a certain percentage of the class that can get an A, and the others, no matter how hard they work, can't get an A. That's completely the antithesis of grades of translation. You say in advance, this is the grade I want, here's how I'm going to achieve it, and then you say, did I receive it at the end? I hope you can see that there's a parallel between grades of translation and criterion reference grades, which are not that common, but should be, well, little advertisement, should be more common in education. Where do we go from here, Arle?
Okay. Well, let's now take a look at how these grades are actually structured. We've created a 3x3 grid of grades. And essentially, we're looking at the top at this axis, which we've already mentioned, called correspondence, which you can roughly think of as being accuracy in terminology. So Does the source say what the target, or sorry, does the target say what the source said? And does it use the right words to say it? And if so, then you can say, well, there's a high degree of correspondence. Now, the vertical axis is fluency, which is really how well the text says it on its own, without respect to whether it's a translation or not. Is it a really good example of, I don't know, Albanian, or is it a slightly stilted version of Albanian, or is it really hardly comprehensible Albanian? And this gets at the idea of fluency. So we have this grid that looks at these two axes. And what we say is that high grade is translation or interpreting that is very polished on the fluency scale. It sounds like a native speaker said this, that there are few, if any, mistakes. It comes across as a good example of whatever language that is, from Albanian to Zulu. And on the correspondence axis, we say that the target content should correspond completely to the source content. And here we have to put in an important caveat. This is relative to the use case. So in some cases, the use case may say you need to make certain changes. The example I like to use is if you're translating a text about electrical wiring from US English into German, and you mention a ground wire. In English, you'd say, well, it's bare copper. But if you translate that into German as bare Kupfer, it will be wrong, because in Germany, that wire has a green and yellow sheath. So in some cases, you need to make changes, and that's part of what the specifications tell you. Now, of course, if I was translating that into German for a German doing electrical work in the US, then bare Kupfer, bare copper, would in fact be correct. So you really have to understand your audience and purpose to make these determinations.
So you're suggesting, for example, in literary translation, children's literature, if the specification is make it sound natural to the child in Polynesia who's never been outside of the islands, well, then a Washington State apple might be translated as a mango.
Yeah, or something like that, yeah. So there's a lot of adaptation that can happen. And when it doesn't, it often looks weird. I just recently saw a children's alphabet picture book that had been translated from French into English and preserved the pictures and everything in French, and so it no longer was an alphabet book in English. It was actually really bizarre to see what was supposed to be A is for apple kind of thing, and I don't remember what they were, but it clearly had not had the right specifications.
Now, for court interpreting, you're not going to make those adaptations, right? That's going to be very source-oriented interpreting.
Yeah.
But for some other kinds of interpreting, where there are no political stakes, who knows? You tell us. Are there cases where the interpreter is allowed to make some adaptation to make it sound, to make it more understandable to the target, even if it doesn't correspond exactly to the source? Or maybe that's never okay in interpreting. We're not the experts, you are.
Well, I'll cite here, I don't remember his first name, but Muromatsu, who was the interpreter for, Japanese interpreter for Ronald Reagan and Margaret Thatcher, gave a presentation in which he talked about something where, and let's set aside whether you like Ronald Reagan and Margaret Thatcher or not, that Margaret Thatcher said something in a meeting with Japanese officials, and Reagan turned to her and said, "I love you, Maggie." Well, anybody who speaks English would know he's saying, right on, way to go. Muromatsu said, I can't interpret this into Japanese literally because it will sound completely inappropriate. And so he thought of some other term of approbation that worked. So there are cases we can see where it's needed. Now, looking further at the grades, I'll just say the purple, the medium grade, is where you have some deviation from this really complete correspondence and this very polished fluency, where, okay, I can understand it. It may not be perfect, but I don't have any trouble understanding it. That's going to make it medium grade. Or where we say there are some deviations from the source to the target, but they don't affect its usability all that much, but maybe not complete, but it works for this situation. And in some cases you can say that's what I need. And then finally, if you get to the low grade, at the far end, it's just gistable. You say, well, I kind of get a sense of what this is talking about. The fluency is so bad, but I can still tell that this is about motorcycle maintenance and not Zen Buddhism, and that's all I needed to know. That would be low grade. And similarly, if you can tolerate quite a bit of slippage in correspondence, it can be low grade. Maybe all you need to know from it is, was this favorable or negative? In which case, you don't care whether all the words carry across in the proper sense, as long as you understand what the intent was. So this can be a low-grade translation, and there are lots of use cases for that. Probably not a lot of use cases for low-grade interpreting, though, I imagine.
I don't know. Maybe. I have no idea. I'm anxious to find out. You keep mentioning Zen and motorcycle maintenance. Isn't there a book about that?
Oh, that's why I chose that, Zen and the Art of Motorcycle Maintenance.
But if the book is about how to maintain a motorcycle, and it comes out about how to maintain a giant crane that could knock a building over, that definitely could be problematical.
Yes. Okay, I'm going to go on and now show one chart where we've adapted these requirements specifically for legal translation. Because people often talk about legal translation as it's one thing, but even within legal translation, you can accept different grades. So for example, let's say you're looking at a translation of a court filing that was from the US, and now it needs to be submitted as evidence to a French court. At the high grade, it may not actually seem that fluent because you're going to follow all the convoluted and stilted requirements for French legal submissions. And the correspondence will actually require you to adapt from common law to civil law. And this is something that requires an expert, probably a lawyer who does translation, to get just right. That high grade is really hard to get. But if you're going to submit to a court in France, you need it. On the other hand, you could take that same contract, and if it's a French legal firm that just needs to use it to inform an argument they're making in court, they need to know pretty much what it says, but they don't need that adaptation because they understand common law terms well enough. And they can tolerate if it isn't completely convoluted gobbledygook needed for a court thing. Here we're really stretching fluency, by the way. But that would be medium grade, and that would be perfectly good for a lot of internal uses. And then you could even take the contract and run it through a process that gives a very low grade translation if it lets you know, is this relevant to what we're doing? And then you might decide, well, now we need a high grade translation or a medium grade translation. But the low grade serves a purpose if it lets you know whether you should do something with this. So from this, you can see that grades, they're a general concept, but they have specific applications for different use cases and scenarios. And again, this allows you to start having the conversation about what the real requirements are beyond that.
Now that conversation, that can take place after production, right?
Oh, yeah, if you want to redo it.
Never delay that conversation. Never have it after production begins. Go ahead.
Okay, so Alan, this is for you to look at some of the recommendations and use cases.
Okay, well, now this is not, there's nothing firm here that has to be followed all the time, but here's a few sample use cases for high grade. If you have a legal text you're submitting to a court, and it's going to influence some kind of a court decision, very likely high grade. Medical communication with patients, where it could affect their health, well-being, even their life, obviously high grade. Software and web pages, where you really care about how people think about your website and your company, your organization, or software where you actually want them to buy it and be happy with it, be it localized, that's probably high grade. Patents, well, they're two very distinct cases. If it's a patent to be filed, that's one thing, where it has to be subject to scrutiny and could be the subject of a court case on infringement, versus, oh, we got a whole bunch of patents here. Are they relevant to the patent that we are, these foreign patents, are they relevant to what we're doing? That could be probably medium or low grade. High profile marketing, definitely high grade. And then typically other cases where there's a high risk of harm to people, to equipment, or to reputation if there is not sufficient correspondence and fluency. Now, medium grade. Well, internal reports and minutes, not the announcement that 17% of the company is being laid off. Just, we're having a party, and as long as you get the location right, a few little details, or if it reads well, probably doesn't matter. Service documents. Now here, this is a well-known medium grade case where it's got to allow you to perform the maintenance or the repair or the construction or whatever, but it doesn't have to be really smooth prose as long as it allows the task to be accomplished. So the fluency can be a little lower. Informal emails, and especially cases where there's interaction, where if something looks strange, you can immediately go back and ask for clarification. That is often a justification for medium or even low grade. Let's look at that. Okay. So low grade, okay, triage. We actually talked a few minutes ago about triage, where you've got a whole set of documents. You cannot possibly ask for a high-grade translation of each one. It'd be great if you could. You can't afford it, time or money, but it helps you decide what to do next. Gisting is on one particular item. Corporate tech support. Sometimes people put out tech support articles, raw machine translation, and then they see if they get complaints. Sometimes that works. That's a tricky one. And then automated data mining, where you really are just trying to find some needle in a haystack. Any other cases where lack of correspondence and fluency have a low risk associated.
Okay. So let's look now a bit at some notes on the use cases. When we talk about grades, they're really only meaningful with respect to use cases, because if I just talk about high, medium, and low grade, but we don't have a use case to talk about them, they're too abstract. So you always have to look at them with respect to specific use cases and what you need with them. Now, each grade is actually possible for each use case, but some wouldn't make sense. For example, you probably would never request a high grade translation for gisting or e-discovery, because, well, that would defeat the purpose of gisting or e-discovery, which is to decide whether you need a higher grade. And you also wouldn't use low grade for a legal contract to be signed or a patent to be filed, even though you might use them, as Alan said, if you just need to know what's in them. And for correspondence, again, what's allowable or desirable varies by use case. So we talked about this with the example of going from common law to civil law. But we see this all the time with marketing, transcreation, where there's a lot of adaptation made. But that wouldn't be allowed in translation of a deposition or interpreting in a court case where you're not allowed to try and influence this at all. Now, some other notes. Oh, somehow we've got a duplicate here of some things. Oh, no, sorry. We've got that grades are a discussion point and not an evaluation tool. Alan already said that.
It's worth emphasizing, and we'll see about evaluation later on.
Okay. And then, Alan, you'd wanted to talk a bit about how grades correspond with, or typically correlate with risk.
Yes, generally speaking, if a risk analysis, say, is in terms of, well, what is the risk associated with lack of correspondence or lack of fluency? But there are very many kinds of risks. We don't want to just think about damage. There are also questions of, well, what is the risk to my budget? and if you find that, well, otherwise, on another basis, it's okay to use medium grade translation. But you know what? I feel like being fancy today. I'm going to request a higher grade, and I'm willing to pay for it. So you're not a slave to risk, but risk analysis can keep you from using a lower grade translation when you need a higher grade. So it's not completely straightforward, but it's essential to conduct that risk analysis and say, can I live with this grade? Go ahead.
Okay. Now we have the three aspects of grades.
You got You got to describe the use case. How many times have we said that? We need to say it more often. Tolerance for deviation in correspondence and fluency, that's the description, and make sure the risk is tolerable. Well, what do we want? We want well-defined specifications. Grades, use case and grades are important stepping stones toward that well-defined set of specifications. If the requester and the buyer, we haven't said this yet, know each other really well and they're very experienced, they can spend only a few minutes or seconds on identifying the grade. Somebody else, where they're just getting to know each other, might be a long discussion.
Yeah.
And then, oh, well, how do grades relate to current translation production methods? Well, that's pretty straightforward. Unless you've bought into the hype on machine translation. High-grade translation pretty much requires a human professional to check for correspondence between source and target. Machine really cannot do that at this point. Medium grade is often can be done by someone who knows the subject matter. They know your company. They're an engineer. They don't have to have a great command of the target language as long as they're not going to make terminology errors that could cause damage. And then low grade, well, you guessed it. Low grade is typically produced using raw machine translation. If you say, oh, but I had a human look at the target text, that doesn't mean that it's medium grade. This is only if they check for correspondence, only if they know the source language and check correspondence, can you say, oh yeah, that's okay. That method will give us medium grade. So we've got different methods of production. Technology will change. I have my own ideas about what will happen, but I'm not going to present those now.
Okay, just to add here that currently when we look at unedited MT, it really can't guarantee medium or high grade translation. It might produce output that meets those requirements, but because you can't know that in advance, you can't rely on them to produce high grade translation.
Exactly.
Similarly, you might have machine interpreting that might produce something that's actually pretty good interpreting, but because you don't know that it will, you can't rely on it, and so it is not an option today for high-grade interpreting.
And if 80 or 90% of the sentences interpreted are just fine, well, for most scenarios, that's not good enough for that use case.
Okay. And Alan, I'll just cover this one. When we look at interpreting methods, we've simplified this a bit, but we think, of course, this applies to interpreting. That high grade really, it requires expert human interpreters with domain expertise. We don't see machine interpreting replacing a skilled diplomatic interpreter or a skilled conference interpreter. People are using it as an assistive thing where the alternative would be nothing, but where you want high grade interpreting, you need a human. Medium grade, well, you might be able to get by with generalists or experienced amateurs in some cases. Probably an expert interpreter isn't going to even bother to try and do this because they're going to be focused on high grade. But medium grade, there's ways you could get it. And then low grade right now is machine interpreting or unqualified human interpreters.
And what I'm interested in is you, the audience, providing use cases where low grade interpreting is appropriate.
If we can find any.
Yeah.
Okay.
Oh, the phases, very important. You select a grade in pre-production, conduct risk analysis in pre-production, and then you select a method of production and go into production, of course, generate the translation, and then in post-production you evaluate the outcome. Maybe sample, maybe the whole thing, and if anybody suspects, oh, something's not quite right, did we make grade? That's when you go into analytic evaluation, and little plug, MQM is helpful here. But that's not the topic.
That's for a translation. Interpreting, probably there's something.
You know what? There's an emerging standard for judging or evaluating and interpreting. Okay. But I'm not familiar with the details. Maybe you guys are.
Yeah. And the goal with all this should always be to drive systematic improvement. You can say, okay, we need to improve the specifications. We need to improve the environment. What do we do to make sure we get what we expected next time?
From a quality management management perspective, that's the most important thing.
No.
Yeah, improve the process.
So now we want to talk about the benefits from grades, and hopefully we've convinced you there's something here that you want to look at. But let's ask you, if you had grades, would it change what you were doing, or would it help you formalize what you're already doing? Either way, we see grades as helping you convey expectations to interpreting service providers. This is if you're a buyer of interpreting services. It will help you convey your expectations to your service providers and open up discussions about requirements and specifications. It would actually help you save money if there are lower grade services that might represent an acceptable option for you. Oh, and here's actually one case where low grade interpreting, machine interpreting might work, is if you have people who generally understand the language, but they just need a little assistance and they look at this thing. And that could be a case where you might say that does what we need it to do. You could also improve communication between buyers and sellers through using standardized interpreting grades. It really can shorten that discussion about what you need. Now, for you, if you're a provider, we ask the same question. Will it change anything or will it formalize? But what it will help you do, one of it is differentiate against providers with subpar outcomes. Here's where you can say, we're not like those guys who charge you $2 an hour and outsource it to somebody who barely speaks pick your language and doesn't have proper equipment, and it's not going to be acceptable. You can point to the differences in grades and say, here's what we achieve, and here's why you should pay for it. And this then justifies the price differential compared to cheap or free machine interpreting. It can also help you educate your market and help your requesters understand the difference. And it will help you describe your offerings clearly when you can say which grades you offer. And then change the initial discussion with potential customers. Now we're almost at the end, but we wanted to talk a bit about standardization.
Well, here's the thing with standardization. If you're not interested in how standardization takes place, your eyes are going to glaze over. So I'm going to say, if you want to know about what we're doing to standardize grades, grades for translation or grades of translation, ask. I'm not going to offer unless you ask.
Well, it's worth saying, though, that these things are moving forward.
They are
on the
moving
translation
forward.
side.
They really are. Through major international bodies that specialize in creating standards.
Okay. And if we ask about what about interpreting, well, obviously, as you've listened, you've no doubt, we've said it, but you've detected, this is really coming from the translation world. So if this is going to move forward in the standardization for interpreting, we need people like you to tell us, how do we improve this and make it interpreting centric? Now, we've done minimal adjustments for this audience, but we're clearly not experts in spoken language services. And Natalya, when she invited us, knew that, but still thought there was something worth discussing. So the question really at the end is how this will benefit you. And assuming it would, which we think it will, how we should coordinate activities across providers and between interpreting and translation so we all achieve the benefit. I think we're in agreement that this is worth pursuing, at least Alan and I are, and we hope that we've convinced you that grades could serve a role in improving conditions for interpreters and in improving the business situation for interpreting companies. Any last words, Alan, before we move to discussion and questions?
I look forward to those questions with fear and trepidation. Go for it.
Okay. As long as you aren't throwing rotten tomatoes at us, we'll be happy to hear them. Okay, and with that, open it up for questions, but there's our contact information if you want to reach either of us to discuss anything further.
Wow. Excellent presentation. So I have a question. What are your thoughts of machine interpreting and or specifically AI, artificial intelligence in interpreting? And should interpreters be aware and equipped to talk about artificial intelligence in interpreting?
Well, I think we should both talk about that. I'll take a first stab. the key word here in artificial intelligence is artificial. It's by their own admission, it's not real intelligence. And what does that mean? Well, it means that they don't know what they mean. The machines do not understand what they're doing. They are simply following pattern, doing pattern recognition, doing it all mechanically. What that implies is that until there's a totally different paradigm for real intelligence by machines, then they will be able to mimic humans without understanding. They'll be able to make it sound quite smooth, as they do in written translation, but there will be unpredictable instances of lack of correspondence because they don't understand what they're doing. And so I don't see the current paradigm of machine learning supporting high-grade translation or high-grade interpreting. But a whole paradigm, new paradigm would be needed. I'm anxious to see what or hear what Arle has to say on that.
I agree with Alan. What we see today is what one of my colleagues in Germany calls the parrot problem. You know, MT, artificial interpreting, machine interpreting, can only repeat what it's heard in some fashion, but without understanding. And so you run into the situation, it's like a parrot that can say things that may sound good, but there's no real understanding. And this really limits the applicability to areas that don't tend to require a lot of human intelligence. They don't require what a skilled translator or interpreter would do. And so these limitations really restrict the applicability of machine interpreting in a lot of cases.
Definitely, definitely. And I would like to us to talk a little bit about a different application of the grade categories to interpreting altogether. As you said, requests for low quality translation or expectation for poor quality are never acceptable. And the same should apply and does apply to interpreting. So what we deal with is that a healthcare provider doesn't have what I want to make sure that we understand that if a healthcare provider doesn't have a qualified or certified interpreter of a certain language available for a specific appointment, it does not mean that they should use or settle for an unqualified bilingual person to interpret and then think that they are meeting the requirement to provide meaningful language access to the patient, because they're not doing that if they're settling for that, right? So we need all to agree and educate the providers to understand that in this particular moment, when for different reasons they may have to work with an unqualified individual who speaks two languages, I don't even want to call them interpreters, right? That they should have to take additional steps to mitigate that disbalance, because they're literally getting a low grade communication, not even interpreting, because more telling, right, or gisting, and they need to make sure that if they're, resorting to that, that they are not simply just, oh, we don't have certified interpreter, we'll just pay less for an unqualified one. They need to recognize they're providing a substandard service, and they need to mitigate for that. They need to compensate in different ways. Like three common ways come to mind. Number one would be they have to simplify the language to the point that an unqualified bilingual individual will be able to understand and not cause harm by misunderstanding. Second, they could lengthen the appointment time, so they could stop and every time do a teach back, ask the patient, did you understand that? Tell me what you understood. So they compensate for the fact that they are using a non-professional. And in the extreme cases, they should not rely on verbal communication to be a tool for diagnosis, right? And it's possible, right? In some cases, maybe just do extra MRI. It will cost you more, obviously, but that's your, situation, your decision, your risk management. But you cannot just, think that because you have no other option than low grade, that you're providing interpreting services. So I see the grades as a conversation starter to ascertain that we know that there are some mitigation strategies that the providers must implement if they are in a position to accept the low grade interpreting. So what are your thoughts about it? Do you think we need to introduce some other parameter than risk to assessing that the interpreter, assessing the interpreting grades and expectations?
Is that question to the
It's the
whole
question.
audience?
It's the whole question to the whole audience and to you, because I just wanted to see, like, how do you feel that if we adapt it in that way also, not just the parameters that you introduced about the risk, about correspondence and fluency, but also the fact that there's simply maybe no interpreter of qualified interpreter for a specific language, be it indigenous language or just language that is of low demand in that particular area.
If I can observe, this is really, I think, one area where it's quite different from translating. And I thank you, Natalya, for bringing this up, because if you're just looking at the spoken language scenario, you generally can find someone to meet a requirement, because they could be anywhere in the world. Maybe you would find a subject matter expert, but it's much less acute for written language, although the concern's still there. But for spoken language, this idea of mitigation strategies, I think, is really key. Because if you know you can only meet low grade, say you have a speaker of CoreCHI Mayan who's visiting New York and falls ill, and the only person who can help interpret is the teenage son of this individual. I think I hate to think of the ethics and everything involved in there, but if that's what you have to use is that individual, then you need some serious mitigation, because the moment you start talking about, say, gynecological problems and you've got a teenage son interpreting, you're going to get very low grade interpreting if you get anything at all. So you, as a must, you need to say, okay, we've got low grade, let's bring to bear some way to address the risk that this patient faces and help them out. So I think that's one of the key takeaways for me in talking here, Natalya, is what you've said, that this is a tool to help mitigate risk as well.
Thank you. And Alan, any thoughts?
I'll put in something a little bit different. One benefit of having, well, presumably 3 grades of interpreting is that it simplifies that discussion, which can be very time critical, especially in a medical environment. We've got to make a quick decision on this, and if you have to go into a big, long, huge list of parameters, it's going to take too long and too much education. But if everybody shares this notion of high, medium, and low grade and has a pretty good idea of what they are, they can shorten that initial discussion of what do we do? We have an emergency. I'm anxious to hear from the audience and especially from Mila, because she's had some very insightful things to say about how this is going to help protect all the parties involved from inappropriate pricing, which doesn't do anybody any good.
Well, I think it protects everybody involved on very many levels. Again, I'm going to go back to the fact that 80% of buyers or people who engage with use of interpreters don't understand our profession. And so in the end, it's also going to protect the patient, because that quality conversation happens at the beginning. And for those who don't care to engage and understand the big why behind it. They're just going to have to follow laws. I would like to see for healthcare interpreting this be part of the Joint Commission standard. When can you engage and at what part can you engage? So and how do you engage with the interpreter? I think it's critical. And at the same time, when it took us a long time to differentiate why cleaning personnel and family members cannot necessarily interpret. Now we have one more step to differentiate why AI cannot interpret. So I think putting it yes, it's important to educate all of the people in the healthcare, education, and the world industries. However, I think the easiest and best route is to approach it through law and standards. And if we have that coming from the perspective of that's the rule, we know all not to cross the street when the red light is red, So I think it's going to save lives.
I agree. And now turning to the questions and comments from the audience, I just want to start first sharing the comments. The majority of the audience, the comments that we see, saying that, we managers understand and work with correlation of cost and risk all the time, and grades tap into that. Excellent. There's also, the benefit of talking about the difference in pricing if you are, assessed and you are able to get on a low grade or medium grade interpreting. So, however, there is at least one person who commented, I really don't see how grades would apply to medical interpreting. But it seems that the overwhelming majority is thinking that it is definitely a very helpful concept and we should develop it further. One of the kind of common questions I want to read is, at my hospital, we define grades for interpreters and visit types. You say not for interpreting, for interpreters, grades for interpreters and visit types. However, they're all really subgrades of your high grade. Has similar work been done in the translation world of further subdividing or specifying the grades? And I think, Alan, you started talking about the simplifying it, but what if you have, you want only high grade translation, but there is different layers in it? Do you see a value in going deeper on that level or not?
Yes, but only after you've made that initial distinction between among the three grades, and then you can go into more detailed specifications. But you've got to have that, at least from the quality management consultants I've worked with, psychologically and for efficiency, you need to have an initial distinction of 2 or 3 categories, and then you could then go into more detail within one of them. Does that partially address your question, Natalya?
I'm going to jump in and complicate it. I think conversation of grades is going to be different, well, incredibly important, but different for interpreting, because we are dealing with the low instance languages that in some case don't have developed terminology. And so I think when hospitals go and say, in terms of differentiation of grade as its experience of an interpreter in that high grade category, that doesn't necessarily, I don't think grades will apply necessarily that way. There may be low grade that's not just AI and machine interpreting. There may be a low grade that's based on linguistic readiness of a particular language to have terminology and concept. And as an example of that can be, for example, Mayan languages, where the recent term for, I believe, our airplane is an iron chicken, and certain concepts of medical terminology don't exist in principle. So in interpreting, in healthcare interpreting, I think we need to address it with special care. And because it's almost like it's no longer a 3D, it's now a 5D challenge.
That's right. And that's why I brought up that concept of mitigation strategies, that when it happens at the beginning and you understand that either due to supply demand or linguistic challenges, or the fact that you will never have a professional interpreter for a very rare language, right? You'll just always will be using an individual who is available and who is bilingual and maybe even related. You need to understand what are the mitigation practices. And I think that would be an important part of developing this, when we adjust the grades to the interpreting world. I have a specific question about the grades. Have you had the opportunity to do any field testing and validation or any research as applying these grades to translation? Or is it just the beginning of the, project?
I can address that. We're still early on, but the reaction from LSPs has been somewhat mixed. I mean, there's ones like Mila who are very excited with this. They see the point, but where we've really seen uptake so far has been from buyers of language services at large organizations who often realize that they need to differentiate quality expectations across a large portfolio and see this as a cost-efficient and effective way to set their expectations and avoid a lot of churn and the waste that comes from over or under production and from having unrealistic expectations. So they immediately grasp this. And ones that have to purchase through procurement departments especially like it because it would give them, if these are standardized, it would give them something they could point to that will convince procurement departments not to completely obliterate their requirements, which is often what procurement departments tend to do. They say, well, we're asking for translation, all we care about is price, and all this stuff you've got is kind of nonsense. We don't know how to put it into an RFP. But if you can say we need high grade translation for this and medium grade for this, the procurement departments can understand that and use it if it's standardized.
Yeah, but I will admit that it hasn't been tested that much. We're in the initial stages. We need a few brave language service providers to actually try it out in the field, in discussions with, especially with new requesters. In particular, it's not a derogatory term, low maturity requesters who don't have that much experience, to see if and take notes and report, does this actually help the conversation? We strongly believe it will, but no, it's time to do some field testing. Any volunteers?
That's right. That's right. One of the comments, and yeah, thank you, Mila, for raising the hand, right? One of the comments, we always definitely helpful material for our organization. We always strive to accomplish a high grade translation, but some material would be okay as a medium grade translation because we can hardly keep up. And of course, they're talking about the healthcare organization. So a good topic to cover with our group of translators. So you may have some, takers for this topic among the medical organizations where they have, need for translating medical materials, and some of it, like for example, right now a lot of patients and doctors communicate via text, and it could be like the appointment is switched or whatever. So that could be a medium grade. And when you have the actual patient education materials that need to make sense, regardless of what country you're from, that and speak Spanish, that could be a high grade translation. So that could be helpful in allocating resources within a healthcare organization and budgets to do the translation. So don't think of it just as a translation in general. It does have specific need within the healthcare field. And one of the comments also was talking about at some point during your presentation, you asked if we sometimes do interpreting where we substitute things just because you have to. And one of the examples during the diabetic education, when you're talking about carbs, potato and bread or pasta, right? You have to substitute these words, like you gave an example with that, mango and apple. You have to substitute it to rice and tortillas because or millet and rice, because in some parts of the world they don't eat pasta. They'll think like, oh, then I'm good. I'll just continue eating my tortillas and I'll be in compliance with the diabetic education. So definitely the parallels between interpreting and translation world in terms of that exist.
And in some languages, there is no word for carbohydrates. There's only word for the actual food that you eat.
That's right.
And we've had experience that in the languages of the former Soviet Union, where during the Soviet rule, a whole number of languages were pretty much banned or not allowed to use. So when the Soviet Union collapsed, languages emerged and communities wanted to speak their languages again, and they had a 70-year gap in terminology development. So as languages are coming online in a way, there is lack of terminology or concept, which is another part less challenging in the world of localization and high tech, but more challenging in the world where people's lives are at risk.
Absolutely. Absolutely. Another very interesting comment of like very specific application of grades in interpreting, right? To me, in medical interpreting, grades can also be interesting and important for documenting encounters, especially in the cases where medium or low grade was the only interpreting level available for whatever reason. And having the doctor notes reflect that this may be helpful for other providers who continue care that they read later on. Like if they discover, if they now use the higher grade interpreting, then they may have the opportunity to double check if everything that happened last week when there was low grade interpreting available, if they need any re-education or, correction there.
And
I think that's an important, quick and very precise mechanism, right? You just put, high,
well,
medium, low.
I would like to see as one of the outcomes of the standardization, if only low grade of interpreting is available, whether for whatever reason, the doctors are asked to use what's called back channeling technique. That's when you're asking the patient to state back what they understood. And basically it's like a back translation, right? It's used in life sciences a lot. And but making that part of the standard procedure, asking the patient of what they understood to kind of repeat it back. And then you're going to be able to see a gap and correct it right away, because if it relates to how the patient will intake medication, that again can be life-threatening. So I think that can be implemented as part of the doctor's checklist.
And I think one of the conversation thread also in the comments is about would the interpreter need to adjust their level interpreting to the grades? Would you have like high, medium, and low grade interpreting? No, that's not what we're talking about. We're not talking about that this interpreter is a high grade interpreter, and now because a low grade interpretation is needed, they'll somehow miraculously will be doing low grade interpreting. No, that's more about the decision making at the organizational level, scheduling level, resources allocation level, like triaging interpreting services versus, I'm suddenly, because ultimately I want us all to remember what all started with. Grade B eggs are still eggs. They're good, they're edible. And so interpreting at a low grade level still, needs to be interpreting, right? So
Natalya, I want to address what you're saying. I think that may be reviewed as adjusting the register. And actually, a very highly skilled interpreter is the one who is able to adjust his register depending on the audience level of comprehension. Are you talking to a group of PhDs, or are you talking to a group of people who are functionally illiterate for whatever reason in their life, and then you're adjusting your register of conveying the same concept? I actually watched Alan Melby do it very skillfully when we're talking about the different concepts of quality. He was able to summarize the gist of a whole ISO standard in a couple sentences in a very simple way, and that is a good way to explain what it is about to somebody who may not have the ability to comprehend, based on whatever reason, the entire 100-page document, right? So highly skilled interpreters are the ones who are able to do that.
I'm going to take advantage of this very slight pause to say that I'm very impressed with the question answer. We're up to 54 items in the question answer. We can't possibly address them all in the last few minutes. Is there anyone on the technical side who can capture the Q&A? Good.
Absolutely.
And we should
And I'm
probably make
going
that
to
into
share
a document. Yes, and share it. And maybe I should not be so bold, but maybe CCHI can have a little piece of their website where we can have a kind of an ongoing discussion of some of these interesting and relevant comments.
Absolutely. And that's actually brings me kind of, since we're closing on the time, I want to, thank all the audience for participating, and feel free to email us the questions, and make the announcement that, as we started this webinar, I mentioned that Mila and I were working on the project. Well, in a couple of weeks, all of you will be part of that project, which is, the National Task Force on Language Proficiency for Interpreters has been working on since this spring. And we will have a survey about language proficiency standards and how different, in a way, there will be an opportunity to talk about the different levels of language proficiency and how they could correlate to the topic of today, of grades of interpreting. And so there will be a website dedicated to that. It will be a work in progress for several years to come. And I do think that it's important to have this particular thing as a section that would be permanent. That's where you will have the recording of this webinar and the PowerPoint slides that you could download as PDF document. We also are going to email you the certificates by December 1st, along with the link to the downloadable PDF slides. And at that time, if the recording is already available on the website, you'll be able to see that as well. The link will be to that page. I want to thank Arle and Alan and Mila for first of all, for bringing it to my attention so that I could share it with CCHI commissioners. And then we all jumped with joy, saying like, yes, let's do it as a webinar, and let's do it before the year is out. So because we want to start this language proficiency for interpreters project. Any last minute comments? Please go ahead. So how about we'll start with Arle, and then we'll go Alan, and then Mila.
Yes, thank you for the opportunity to address this audience. It's greatly appreciated. And I've learned a lot from talking to Natalya, because the interpreting environment brings in new concerns. I also want to give a round of applause for our ASL interpreters, who have had to do, I think, a heroic job with a topic that is surely outside their normal field of discussion and interpreting, and I think they've probably done a fantastic job. So thank you.
Alan.
I'd like to thank everyone, and especially Mila, for helping this happen. She's well, everybody knows it, but she's a doer. She gets things done, and we appreciate not just her energy, but her demeanor. It's just nice in a disagreeable world to have an agreeable facilitator who gets people together. Thank you, everyone.
Thank you. And I want to thank everybody who took the time to participate today, because among you is the group that is actually going to solve this problem and solve this challenge for our industry. And I see the outcome as new standards coming out, and hopefully getting as part of the Joint Commission checklists and all of the accreditation bodies that actually tell hospitals and healthcare organizations on how to properly and safely and correctly deliver language access. So I'm looking forward to different groups, different task forces, and the outcome of the brilliant professionals that are within our field that will affect our industry.
Thank you, Mila. And also, on behalf of CCHI, I want to thank MasterWord for sponsoring today's webinar with the wonderful ASL interpreters, Kim and Kelly. We've had a couple of fan comments saying how wonderful you are. So please, celebrate it. And I hope that everyone enjoyed today's presentation, and we will see you answering the surveys and participating in this project for months and to come. Thank you, everyone. Have a great end of the day.
Thank you.
Thank you.